The more we learn about COVID-19, the more we learn about how aggressive the virus is for adults and children now. And tonight, you're asking, how does COVID-19 affect the young people? Larry Miller has some answers on this. Hi, Larry.
Tonight, as the weeks and months in quarantine teach us more about COVID-19, the more we now know how the youngest members of our families are affected. Initially, researchers believed children might have some immunity to the virus. Turns out, that's not the case. Since the outbreak of COVID-19, Children's National Hospital in Northwest has seen a significant number of children who've tested positive for the virus. Dr. Charles Beurl is the chief of cardiology and co-director of the Children's National Heart Institute.
In the hospital, we've had somewhere between 230 and 250 positive tests in children, of which approximately 60 have required inpatient admission.
Of those 60 inpatient cases, he says a quarter received intensive care. The good news? They've all survived. WSA 9 contributor and infectious disease specialist Dr. Nabha is also seeing cases of children presenting with symptoms.
Children more likely will either get a mild illness or many times will be asymptomatic, not present with symptoms.
Healthcare workers are also watching out for a new disease with possible ties. It's called the Pediatric Multisystem Inflammatory Syndrome, or PMIS, which is treated like Kawasaki disease, or KD.
It includes fever for more than 5 days, again, swollen lymph nodes. They get conjunctivitis or pink eye in both eyes. And then some unique things that we don't see in other syndromes are this strawberry-colored tongue, red cracked lips, swollen hands and feet, including peeling of the fingers and toes.
Dr. Beurl says the condition can be treated, but the key is to act fast. For the Q&A, I'm Larry Miller.
Dr. Linda Nabha says COVID-19 is no longer just a respiratory disease. It can affect the entire body and every organ.